Blood clotting. An enlarged view of the damaged area or a rupture in the blood vessel which causes immense loss of blood. Inside the artery, we observe the RBCs and platelets which escape out through the damaged area. The platelets play a very important role in the initiation of blood clotting. The blood platelets release a substance called thromboplastin. In the presence of thromboplastin and calcium ions, the prothrombin present in the blood gets converted into thrombin. This results in the change in the shape of the platelet from its earlier resting state to its dendritic form, which indicates its activation. The interlocking mechanism of the dendritic platelet causes platelet activation, which also trigger the coagulation cascade and thus the formation of thrombin. This thrombin now catalyzes the conversion of fibrinogen into fibrin. These fibrin travels towards the damaged area. Here, these thread-like fibrin forms the mesh. The RBCs get caught and remain entangled. These RBCs and fibrin thread together form the blood clot. This clot manages to plug the gap in the ruptured artery and thus prevents further blood loss.